Hello, people of the internet. No, just kidding. I'm here to tell you what PTSD is. And if you are just like me, you might not really know about it. You might not have the biggest general knowledge on it, but I'm here to tell y'all what it's about. I did my research. Obviously, if you didn't know, PTSD stands for post traumatic stress disorder. You may be asking, what is PTSD? I'm pretty sure you hear it a lot. Some people, I've heard it mentioned pretty frequent in my life. PTSD is a mental health disorder that is triggered by a traumatic event or a terrifying event, to be more specific. This can happen to anyone who has experienced the event from anyone who has witnessed the event. So it doesn't generally specifies into one person. It could go to different people. Now, some signs some signs you might want to look out for, or like some things that could generalize to know if someone may have PTSD or like help you find out would be like flashbacks, nightmares, severe anxiety, or uncontrollable thoughts about said event or said trauma that's happened or anything that might have scarred you or something. Now, when it comes to the symptoms, obviously nightmares will be included in that as it is also a sign. We also have unwanted memories of the trauma, avoidance of any situations that might lead to that big memory of trauma being brought back in. We would have heightened reactions, anxiety, and depressed moods. Now, this condition is very interesting because PTSD is it varies. It varies from people, I would say, because you know it may last for months or years, and you might be good after 6 months, a year, 5 years, it depends on you. But said events, say said memories or anything brings back that said memory or trauma that was accompanied with all of that, it will bounce back just like that. And it leads to intense emotional and physical reactions. So, I think that's pretty fascinating, honestly. Um, Treatment tends to be in different types of like trauma focused psychotherapy. So we have medication to manage the symptoms as one of them, and then we have the therapy to manage the symptoms. Now I'm going to get into the therapy side, and then we're going to get into the med side. Now, to be honest, this tends to vary. Obviously, everyone reacts to things differently. Some people preference the not taking meds way. Some people preference the talking it out type of way, or like therapy, well, obviously. But let's get to the treatment section. There's therapy and there's meds. The therapy is cognitive behavioral therapy and eye movement desensitization and reprocessing. Now, I'm pretty sure you're probably wondering what that is. Well, I'm here to tell you because I did my research. Let's be real. I don't even know what it was at the beginning. But let me get to it. Cognitive behavioral therapy is talk therapy based off of like modifying your negative thoughts, behavioral and emotional responses and tendencies, which are associated with that distress. Now, I feel like this doesn't per se would work for someone who's like headstrong. You have to really be able to like not dig deep, but some people don't preference the talking method. So there's always the eye movement desensitization and reprocessing, which is psychological treatment that reduces your stress through eye movement exercises or through like doing anything through your eye movements. It's like testing you in a way. I find that fascinating. I didn't know that was actually a form of therapy, which to me that's very unique. Now we go to the meds aspect. We get to the SSRIs, yeah, which tend to be, meds that ease symptoms of depressed moods and anxiety. Now, obviously, those are two different things, meds and therapy. If it were to be therapy, you'd be going to a clinical psychologist who helps treat mental disorders with primal, like, talk therapy. Now, if you were to go for the meds route, you're going to a psychiatrist, which tends to treat mental disorders with meds. I feel as though this tends to vary for whoever it is. I didn't know this much knowledge on PTSD, and I hope you gain some type of knowledge on PTSD. And I hope whatever I talked about today, hope you take it with you. Hope you learned something. Thank you very much.